Welcome everyone to the WIC WORKS webinar. The title is WIC Can Improve Interconception Health. This is Margaret Aumann with California WIC Association, and Karen Farley is with me as well. We welcome you all and look forward to this webinar. Hopefully you see our introductory slide. I'll be taking you through a little introduction and overview of Gotowebinar, and then we'll pass the baton on the screen to our experts on interconception health, Denise G. and Sharon Anthony from PHFE WIC program in Los Angeles. So the objectives today are to look at research and practice, and we'll explore optimal postpartum care, looking at ways to prevent premature births, and we'll get an inside look at the WIC Interconception Health Pilot Project that PHFE did. So just a brief overview of Gotowebinar. If you're new to this system, you can listen either using your computer speakers or by telephone. If you do have any internet audio problems, you should call in on a landline, and the number is there as well as on your invitation. If you are connecting by phone, please don't put your line on hold. That does cause some interference, but you can always mute your phone if you like. If you can't see the slides, which has been a problem in the past, you might try exiting and then re-entering the webinar. We apologize for that glitch. And there's a helpline at Gotowebinar if you need any help. Just if you're new to this screen, your control panel is on the right. Nobody else can see that. You can hide it by using this red arrow and then bringing it back. If you do need to switch to the telephone, here's the way to do it. And instead of the chat function, we're going to use the question box, which isn't shown here, but it should be on your control panel, and I'll explain that in a minute. And there's different ways to view full screen or window and that kind of thing. So about questions, which we'll try to answer as many as we can at the end of the webinar, you'll just need to type it into the question box. We'll be able to see them and screen them to see what the priorities are and ask our panelists to answer them. We are recording this webinar, and the recording will be available at our website. I'm sorry we can't offer CEUs, but if you are tweeting this webinar, please use the hashtag WICWORKS. Just a little bit of background before we go on to our featured presentation. The California WIC Association, if you're not familiar with us, we're a nonprofit organization serving 84 local WIC agencies in California. But we represent all parties who are interested in the operation of the WIC program. We provide training and staff development, conferences, advocacy, and these kinds of webinars tie into our research and policy analysis role. So everyone is welcome, certainly, to use our materials. We try to keep our website updated for that, and we welcome your participation. I'm going to have Karen introduce our panelists as I switch over to their screen.
Okay, good morning, everyone. Thank you for coming. We're really excited to have yet another webinar on how WIC works. We have lots of good data to show that WIC really can have improved health outcomes. So this webinar is about improving interconception health. And with Denise and Sharon, we're going to explore how WIC can have a dramatic and positive impact on a woman's health before and between pregnancies, preventing prematurity, low birth weight, and often the very expensive and tragic costs of poor birth outcomes. Women who've had a poor birth outcome in a prior pregnancy are at a higher risk for reoccurrence, which we want to avoid, and this can be prevented with better follow-up during the interconception period, which Denise and Sharon are going to talk to us about. So WIC can help, and WIC does work. And in this webinar, you'll find out some really good information that you can use, hopefully, in your organizations. So I'd like to give you just a quick little background on Denise and Sharon. They're both registered dietitians. They work at Public Health Foundation Enterprises WIC program in Los Angeles. It's the largest local WIC agency in the nation. and Denise is a senior nutritionist there. She's become a well-known expert in the field of conception care, and she's a tireless advocate on this subject. And Sharon, besides being a registered dietitian, is a marriage and family counselor. She too is a senior nutritionist at PHFE WIC, and Sharon has many years of direct experience with high-risk WIC families, including an award-winning teen mom support program. So thank you, Denise and Sharon, and let's hear your story.
Thank you, Karen. Thank you, Margaret. And hello to everyone. Thank you for this opportunity to be able to be with you today and share about some of the exciting things we are doing here at PHF, particularly in the area of interconception health. So our short time together, I will be sharing about what we are doing with relationship to interconception health in our demonstration project, and along with a number of activities and findings. And then I'll pass it on to Sharon, who will share about the wonderful successes of the Beyond 9 project, which you'll learn more about. So I'd like for us to just begin really what is preconception health? I have before you a definition coming from CDC, so it's a real nice comprehensive one that states that preconception health is a set of interventions that are aiming to identify and modify biomedical, behavioral, social risk to a woman's health or pregnancy outcome through prevention and management. And it really essentially boils down to wellness or optimizing a woman's health, particularly before and between pregnancies. We know that starting during pregnancy at times is oftentimes too late, and so we really need to reach them before they are pregnant. And our desired outcomes would be to help support and encourage women to be healthy, and should they get pregnant, that pregnancy will be healthy, for them to have healthy babies, healthy families, and really a healthy future. It really is an actual natural fit here at WIC and to have interconception health promotion, because we're aiming to do the exact same things as to encourage and support women and families to be at their best health and to have also healthy pregnancies and reduce poor birth outcomes. Across the nation, there are over 5.5 million women who are participating and connected to the WIC program in some way. Either they are receiving benefits for themselves or for their children. So the beauty of having interconception health at WIC is that we have a real broad reach. We'll be able to continue seeing women regularly and develop long-term continued relationships with them as they continue to receive services for their children up to age 5. So we're likely to see them through multiple pregnancies, and during that time when they are not pregnant and that interconception phase. During our time together, I'll probably be using interconception health and preconception health interchangeably. But interconception health is really much more fitting here at WIC because we don't see women typically before they ever have their first pregnancy. It's only after. In 2007, we started the WIC Offers Wellness WOW program. This was a special demonstration project funded and supported by Marcia Dimes, really aiming to look at activities and efforts to reduce and prevent prematurity, and also seeing what types of interconception health activities would work within a WIC setting. So we're real fortunate to have this partnership with Marcia Dimes, and we're thankful to them for that. In the WOW program, we focused and enrolled women who had just recently delivered a preemie or low birth weight baby. So these were women who could really benefit from interconception health support. Our objectives of that WOW program were to improve the health status of these moms who had just had a poor birth outcome, to increase pregnancy intervals and really encourage some child spacing if they were to plan another pregnancy, and hopefully that those pregnancies would be planned, so reducing rates of unintended pregnancies. And if they did get pregnant, we wanted to support them and help them to have a healthy pregnancy and healthy birth, so full-term, healthy weight baby. In the WOW program, we had 151 moms participating and enrolled with an average age of about 28 to 29, mostly Hispanic. And as you can see here, down at the bottom, sadly and interestingly, 41% of these moms had already had a previous preemie, so they were having repeat poor birth outcomes, so definitely a very high-risk group that we were working with. For comparison's sake, we found a closely matched WIC site to act as our control. So as you can see, it was nicely matched. There were a number of findings that really stood out from the WIC program, and one is in regards to multivitamin with folic acid use. We can see here that there's a significantly higher percentage of WOW women who report taking multivitamins with folic acid compared to our control moms. So that was nice. As part of the WOW program, we also ran support groups, monthly support groups. And what I don't have in front of you here are the numbers, but I wanted to share with you that participants of the support groups even had higher levels of multivitamin with folic acid use. So it just shows us that awareness, education, continued talk and promotion and encouragement to take multivitamins with folic acid really can have a nice positive difference. The other finding is in regards to family planning and birth control use. What we see here is a higher percentage of WOW moms that report using some sort of birth control as compared to moms in the control group, 66% versus 54%. So that tells us that moms are planning, that they're either or preventing, they're incorporating some efforts to have some child spacing, which is really what we wanted to be able to see, especially amongst a high-risk group. Child spacing is critical. The other thing that what we wanted to aim to do with the WOW program was really look to see if we could have an impact on birth outcomes. We did see that the WIC WOW program is associated with positive birth outcomes, but I have to share that this was not a research project, and we were working with a small size of women, a group. And in this population, there were, because we had encouraged the family planning and the birth control use, we ended up seeing that there were fewer pregnancies, thus fewer births. But of the births that we did see, there were fewer preemie and low birth weight babies among our WOW moms as compared to our control moms, which is a good thing. It's not statistically significant. However, we are seeing that it is trending in the right direction. With perhaps more funding and support, we may be able to continue following this group of moms to be able to observe the birth outcomes. But at this time, this is what we're showing and seeing. So it is showing some positive associations. So what is it that we did during the WOW program and activities that we may have actually transferred over to other WIC sites in our agency? So what I have for you in the next couple of slides are a couple of the strategies that we employed. One thing that we found critical was actually providing staff training. We found that preconception health was an unfamiliar term and concept for some of our staff, actually a good number of our staff, but although they may be familiar with some of the components of preconception health and the work that they do. So we found that it was valuable to provide a number of trainings, in a series of trainings. In fact, it was much more effective to provide them in bits and pieces, and particularly for those concepts or those topics that were less familiar, because WIC is a nutrition and breastfeeding program, so having discussions about family planning and depression or mental health were ones that just were less comfortable for our staff. But with training, it helped our staff to have increased knowledge and awareness, and also the confidence to be able to have this information discussed with their clients. As part of the WOW program, we also had a care coordinator who provided regular contact and services by phone and in person to our WOW moms, and we found that to be helpful to help ensure that referrals and contacts were made. I also mentioned earlier about the support groups, and these were peer support groups that occurred monthly, offered in both English and Spanish, and those were well attended, and some made efforts to attend every single month. Even a mom of triplets who took public transportation would make these huge efforts. And in the support groups, we at times had experts come in, some mental health experts or some OBGYNs come in and share with the group, but there were times when it was just valuable having moms who are experiencing similar, having similar experiences gathered together. I can recall a time when a mom was expressing the challenges of getting about town and taking care of her activities with a child on with an oxygen tank. And another mom who had then just shared of her experiences and how she was able to manage. So those were valuable to have the support groups. The fourth activity is in regards to a screening and assessment form. At WIC, during our certification visits, we asked our parents to complete a form with questions, which we call our nutrition questionnaires. And we found it valuable to include and enhance it by adding in some preconception health specific questions, such as the 6-week postpartum appointment, or a section on family planning, some stress and home environment related questions. We found that if the questions weren't asked, at times the issues or concerns that the client may have may not come to surface, and so the discussions never occurred and the referrals weren't made. So just by having a small tweak in this type of activity, or what we do at WIC, really made a huge difference. We also ran a folic acid education and campaign in conjunction with the California Department of Public Health. Also developed and identified and made available health education resources to our WIC Center staff. One that was very valuable and helpful was having the family pack, family planning, choosing your birth control methods handout. As I mentioned earlier, we are a nutrition and breastfeeding program, and our staff are comfortable there, but family planning was an area that many still have to develop a comfort level with. The other thing that we found to be real useful was the 6-week postpartum checklist that I have in front of you, and that's also available for viewing, and Sharon will provide you the website to access that. In the course of the WOW program, we found that moms either did not go to their 6-week postpartum appointment, or if they did go, it was a poor quality appointment because they did not know what to expect. So this checklist has been real helpful in, one, encouraging moms to make sure to go to that 6-week postpartum appointment, and 2, to let them know what they can expect, and if the healthcare provider did not cover a certain area, that they were then armed with something to initiate with the provider or the clinician. The other thing that we did, and as a result of the project, was develop a special preconception health class, which we titled You Are Special. This was designed to be learner-centered and provided in a group fashion, and it was highly successful. We surveyed parents and participants, about 2,000 of them, the day after they attended the class, and 97% of them shared with us that they found the class and the information very useful or useful, so that was nice. This class was modeled after Marsha Dimes' 9 Things to Do Before Getting Pregnant, and so we found that having this slightly modified for the WIC setting was real effective. At WIC, we recently at PHS developed an online education program, and to launch that off, we actually took the You Are Special Preconception Health class. Since it was well received in the WIC Center, let's give this a try with this as an online format. And because it was an online format, we also provided opportunities for clients who are taking it online to share with us what are some of the changes or action steps they wanted to take as a response of hearing the information in the You Are Special class, or to just the tips for good health. And so what I'll be sharing with you are some actual quotes and responses from clients on what they wanted to do. And I think you'll see that some of these are real moving. One mom said, I plan to take folic acid and talk to my doctor about my next pregnancy. Another said, I will watch what I eat since I now realize I am at an unhealthy weight. I exercise, but I'm not eating right. I will have to work on that. Also, get more sleep when I can. And another said she wanted to be more active, to see a doctor and dentist regularly. And this mom said, because I am overweight and also have a new baby to take care of and be responsible for, I made a promise to myself to start dieting or eating healthy and also get exercise. I will be taking my 3 boys for a walk and also start exercising at home. One said she wanted to quit smoking and lose weight. And another says she will get help for stress and find more people that could help her during difficult times. So it all resonated with others and also at different levels, but it seems to be real effective. So we're real excited that the information in the class and about preconception health topics were information that clients wanted to hear and receive and responded to. So at this time, I'm going to invite and ask my friend and colleague Sharon to share about the Beyond 9 project.
Good morning, or afternoon is it now. The Beyond 9 project was funded by the state special one-time funds in 2009 through 2011. And so one of the main objectives of the Beyond 9 project was to share how we could build on the WIC infrastructure to deliver the preconception health messages. So Denise and I were able to travel as a team to different regions across the state to provide this full-day workshop for staff. So we were able to reach 37 local WIC agencies and also the state WIC division, 29 counties, and then also 1,472 WIC staff. And then this map reflects the counties that were reached through the project. The project officially ended in September, and so you can see that there's more work to be done. So this webinar certainly helps to plant some seeds that we hope will flourish into spreading the message further. So this was our agenda for the training, and one of the specific topics that we did and we like to cover is that we looked at perinatal birth indicators, and we looked at those from a national basis and then in California, and then we looked specifically at the data for the regions that we covered. And this helps staff to really understand the importance of these preconception health messages for their specific county. The other thing we did is that we, in implementing this training, is that we recognized that while we as trainers had some expertise around the topics of preconception health, that we also needed to recognize that the staff had the expertise as to how best to apply and implement these messages based on the unique characteristics of their agencies, because not all WIC agencies work the same way. We're a really large agency, as Karen mentioned in the introduction, and then you have an agency that's really small with the size of one of our sites for the whole entire agency. So you know that those can't be, the information can't be applied in exactly the same manner. Some of the specific ways that agencies were able to implement the preconception health messages was through their counseling of WIC mothers, or they targeted specific high-risk mothers. They had breastfeeding and other support groups where they planned to implement it. And then also a lot of them adopted the UR special class and did that particular group education. A few agencies have even expanded beyond the WIC setting and shared this materials and even the training, the Beyond 9 training, with public health nurses and other professionals within their county. And then we're at our last slide. And to learn more about the Beyond 9 project or PHFE WIC, you can visit our website, and these are listed here on this resource list. And also, if you're interested in the online education, you can visit the website and go on that, and it walks you through as a guest. You can actually go through the actual WIC online education. There's some additional resources on this list, but we'd like to highlight and acknowledge and thank the March of Dimes and the California WIC Division for their support of the Beyond 9 project. And that concludes our portion of the training, and I think we have a few minutes for questions.
Yes, we do. Thank you very much. You can leave that slide up if you would, Sharon and Denise, because people might want to just take a look at it. But also, just as a reminder that these slides and resources will be available on our website very shortly after the webinar, as well as a recording of the webinar. So several of you have asked questions about that, and I just wanted to reiterate that. Right now we're going to take a look at the questions that have been coming in, and Karen's going to help us direct them to our panelists.
Okay, one of the questions was on outreach, and I think Sharon mentioned that, and as Margaret said, the materials are on the website. One question is if the flyers are available, the 6-week checklist. Is that true? Denise and Sharon?
That is true. Yes, the 6-week postpartum checklist is available on our website, so you can access that as well as the other Beyond 9 resources.
Okay. One of the questions was, how do you address religious and cultural issues when you're talking about birth control?
Very carefully. I think that as Denise mentioned earlier, we did have a learning curve with our staff, and they have to adjust to expanding, you know, some of these issues. But one of the things we always emphasize is that we're here to support the mom in making the best decision for herself. So it's really not our decision, so to speak, what would be best for them. It's just equipping them with the information. So I think if that's at all what I say, I don't know if you want to add anything else, Denise.
I think we found it very helpful to encourage staff to start with the goal of the mom. What is the mom's goal? Let's say she wants to delay a pregnancy or not get pregnant for another 18 months. So then that discussion can start there, saying, well, I want to help support you with your goal, and sometimes that may involve some type of birth control method. But if it's something that is inconsistent with what the client wants to do, then we have our staff work with her and respect that as well.
Okay. We have a question about the messages that you gave to the moms on the Beyond 9 program. Did you have a set of key messages?
We did. They focused heavily around the tips for good health that are on the Beyond 9 magnet. Some of them include getting to a healthy weight or maintaining a healthy weight, nutrition, a healthy diet, of course, which is very consistent with what we do at WIC, incorporating some physical activity, encouraging them to plan their next pregnancy or when to have that next baby, to stop smoking, drinking, and taking alcohol if they were doing so, helping them manage stress or lower their stress levels, and also seek some help if they had some levels of depression. So those were some of the areas that we definitely covered as part of the WOW program.
Great, thank you. There's another question. Did you identify the number of weeks postpartum when multi-tip women were most receptive to the information?
Could you repeat the question?
Did you identify the number of weeks postpartum when multi-tip women were most receptive to the information? I can imagine somebody's thinking about when to schedule the intervention and the classes and market it.
I think we did it. I think that particular issue in our agency, we shared with them when we did it. And what we try to do in our agency is do it at the time that they come back to recertify the mom. And we have a special questionnaire that focuses on mom. But we also open it up to them to kind of decide when was the best time for them to implement it, because they might have used the tools in their agencies in different ways from us.
We had one agency, local WIC agency, share with us specifically for their 6-week postpartum checklist to be shared at during the 3rd trimester of pregnancy, because they wanted to arm their clients with the information beforehand. Should the client not make it, or should the client perhaps deliver before they were seen, and also to avoid bombarding her immediately postpartum.
Okay. This kind of is sort of related to that question. It's a little bit technical, so I'm going to read it. The National Committee for Quality Health Assurance, the HEDIS measure, for a postpartum exam is 21 to 56 days. Have you considered changing the 6-week recommendation for a postpartum exam to meet that time frame? Often physicians are unable to get a new mom to their office in time to meet the requirement.
We're going with what is standard. We do encourage moms to definitely have a postpartum type of appointment, whether it be at 2-week, 3-week, or up to 6-week. We are encouraging them to make that appointment, to have a contact. With changes to a different level, I think that it would require talking to a different organization or group to make those specific week changes and recommendations.
I think we have to seize the opportunity also, because a lot of these women, this is a time when they are insured, so to speak, and so we have to capitalize on this contact with the medical community in whatever capacity we can that they are covered.
Okay, well, thank you. I think we have time for one more question. And you know, Sharon and Denise's information are on the slide, so you can always contact them directly at any time. This is a big issue for postpartum moms, and this relates to weight. Did you have weight guidelines for different groups? Or what kind of, did you have any guidelines around the different weights for the moms?
We did. Weight is actually a big issue. Well, worldwide and nationally, but particularly among our WIC moms, where we know that 54% are either overweight or obese. And for those that were heavily overweight, we encouraged them to work towards coming up with a goal that came closer to, that would work towards some weight loss, but also to be realistic. So any decision and goal made to just work towards the healthy weight range was encouraged, and we also focused on BMI, letting them calculate their BMI and to see where in that range they were at. But we also recognized that it would be a process, and in our support groups we did have scales available and a tracking of their weight form, which really encouraged them to continue to work towards a healthy weight. We found that some moms revised their goals once they met that goal.
Thank you so much, Denise and Sharon. We're going to wrap this up now, and I put up one more slide that just reiterates that the webinar recording and the presentation files will be on our website either later this afternoon or sometime tomorrow. So check back, or if you have any colleagues who missed our webinar and would like to have some of these materials, please feel free to share them. And thank you very much for your questions and for joining us today. Thank you so much, Sharon and Denise. Any other comments you want to add at the end here?
Thank you for spending your time with us, and we do encourage you to come visit our website for some of the resources.
Thank you again, everyone. Have a good rest of the day.
Great. Thanks so much. Goodbye.
Bye-bye.